Hello everyone. So today we are going to discuss about Park's 3-step test. As I have already told you about muscle sequelae, so I hope you have understood that topic. It will be easy for you to understand the Park 3 steps test. In this test, we evaluate the isolated cyclovertical muscle palsy. What are the cyclovertical muscles? These are the muscles that have torsional as well as the vertical functions, right? So those extraocular muscle who helps in elevation or either depression and either intorsion and extorsion are the muscles which are the cyclovertical muscles. And in Park's 3-step test, we evaluate the palsy of that single muscle which are the cyclovertical, right, who have either torsional or the vertical functions. So now over here, cyclovertical muscles, for understanding that concept, you should know that in each eye we have 6 extraocular muscles, and collectively we have 12 extraocular muscles in both the eyes. Out of those 12 muscles, 4 extraocular muscles have the horizontal functions, right? So we know that lateral rectus and medial rectus has the horizontal function, that is adduction and abduction. So that is why these muscles are not the cyclovertical muscles, and we have two horizontal muscles in each eye. So collectively we have 4 extraocular muscles who have the horizontal functions only. So these are not in the list of the cyclovertical muscles. So out of 12 we just are left with the 8 muscles which are the cyclovertical muscles. So now I want to tell you that you should learn this picture, and over here you can see the lateral rectus and the medial rectus have the horizontal functions, and they are not involved in any kind of the vertical and the torsional functions. So that is why these are not included in the cyclovertical muscles, and that is why we cannot evaluate the muscle palsy of these two extraocular muscles which are lateral rectus and the medial rectus. So we cannot evaluate the palsy, these muscle palsy by this Park 3-step test. We can only evaluate cyclovertical muscles which we are going to discuss in the further slide. So now there are total 8 muscles which are the cyclovertical muscles that help in that have the vertical function as well as the torsional function. So you should learn this diagram. This H is based on the functions of the muscles. So if you have learned this picture, it will be easy for you to evaluate muscle sequelae and as well as the Park's 3-step test. So here, when the eyeball is in adducted state, when the eyeball is towards the nose or moving towards the nose, the inferior oblique helps this eyeball to elevate and superior oblique helps this eyeball to depress. Now, when the eye is away from the nose or moving temporally, or when the eye is in abducted state, the superior rectus helps the eyeball to elevate and inferior rectus helps the eyeball to depress. So if you have learned or you have memorized this H diagram, it will be easy for you to evaluate which muscle is having problem at which time, right? So now what is Park's 3-step test? By the name you can understand that it involves 3 steps. Basically you have to check the hypertropia in 3 stages or in 3 conditions. You have to see the hypertropia in the primary position when the eyes are straight in the horizontal gazes. You have to ask the patient to see towards the right side, and you have to ask the patient to see towards the left side. And in the head tilts, which will involve the right head tilt and the left head tilt, you have to slightly tilt the head toward the right side and towards the left side. So these are the 3 steps, and we will discuss them step by step. So now the first step states that we have to check hypertropia in the primary position. So when the eyes are straight and patient is sitting in the primary position, you have to see which eye is hypertropic. Hypertropic means which eye is above the normal level, right? So which eye is hypertropic, you have to observe that. In this picture you can see that right eye is hypertropic and the left eye is slightly depressed as compared to the right one. So we have to note that this eye is hypertropic in the first step. So now what was the purpose of first step? Why did we check the hypertropia in the primary position? We have told you that in Park's 3-step test, we evaluate and confirm the cyclovertical muscle, isolated cyclovertical muscle palsy. So we have total 8 cyclovertical muscles. So out of those 8, we have to take one and confirm that this muscle is having problem. That is why the eye is in hypertropic state. So always remember, when you have checked that which eye is hypertropic, it can be either right or left. You just need to learn or memorize and remember that the depressors of the hypertropic eye may be suspected, that they can have, either of them can have problem, and the elevator of the other eye may be having problem. That is why the other eye is looking a bit below or is below the normal level. Here you can see that in the right eye, I have told you in the previous example that my right eye is showing hypertropia. So I have told you the suspicion should be depressors of the hypertropic eye. Why? Because maybe there is a problem in these depressors. That is why eye is not moving downward, and there can be a problem in the elevators of the other eye, because maybe there is a problem in those elevators, and that is why that eye is not moving upward. And right eye, maybe the right eye is normal, but the problem was in the elevator of the left eye. That is why we are doing the first step. Now what happened? From 8 muscles, our suspicion came into the 4 muscles. This means that the elevator of right eye and the depressor of left eye are normal. They are working normally. That is why right eye is a bit hypertropic and left eye is a bit depressed. This means that though these 4 muscles are working, but there can be a problem in the right eye depressors. That is why maybe right eye is not moving down and left eye is not moving up, because there may be problem in the left eye's elevators. Now I have told you that these 4 muscles are okay. Right eye elevators and left eye depressors are okay. There are the suspicion. Our suspicion will be the depressors of right eye and the elevators of the left eye. So we are now from 8 muscles, we have done our suspicion to the total 4 muscles. So now, as we have told you that the elevators of right and the depressors of the left eye are normal, so we have just removed them from the 8 so that it would be easy for us to see that which muscle is having actually the problem. So over here, the right eye depressor, which are inferior rectus and superior oblique, are suspected muscles, and in the left eye, the elevators, which are inferior oblique and superior rectus, are the suspected muscles. So now we have to check that out of 4, which single muscle is having the problem. So let's move on. So now we are done with the first step, in which we evaluated that out of 8 cyclovertical muscles, 4 are normal and 4 are suspected muscles. Now in the second step, we have said that we have to check hypertropia in the horizontal gazes. So first of all, we have to ask patient to see in the left gaze. So here you can see this is the eye is toward the left side. So the right eye is in adducted state while the left eye is in the abducted state. We have to see that the hypertropia which was in the right eye, either it increases or decreases in the left case, and similarly we have to see that this hypertropia increases or decreases in the right case. So we need to check these 2 things, that hypertropia increases in which case. So in this picture you can see that when we have asked patient to see towards the left gaze, so right hypertropia is not manifested in this case. That means that in the right eye superior oblique was working, so and in the left eye superior rectus was working. It means that we didn't observed any abnormality. The gazes are okay, normal. It means that these 2 muscles are working perfectly. Now we ask patient to see towards the right gaze. So what happened when the patient see towards the right gaze, the right eye hypertropia increased and left eye is a bit we can see that right eye is hyper and left eye is manifesting as a hypo. So what happens, that it means that there may be any problem in the inferior rectus of the right eye, and there can be a problem in the inferior oblique of the left eye. That is why that eye is manifesting, or we can see that it is a bit hypo, and that is why right eye is hyper a bit, that there can be problem in any of these two muscles. Now, so we evaluated that out of 4 muscles, 2 are okay and 2 are suspected. Now, so I want you all to observe here in the left gaze, patient's eye is normal, right eye is adducting normally. It means the superior oblique of the right eye, which was suspected, is okay and normal. And in the left eye, the superior rectus is working properly. That is why it is abducting normally. So there is no any abnormality in the when the patient sees in the left gaze. And we have observed in the previous diagram, on the previous case, when the patient sees in the right gaze, the right eye shows hypertropia, which means that there may be any problem in the right eye inferior rectus, and there can be a problem in the left eye inferior oblique. So now these superior oblique and superior rectus are working properly. So we have just removed these 2 muscles, and now we have concluded that out of 4 muscles, 2 are okay, which are superior oblique and superior rectus, and there is a problem, there can be any problem in the inferior rectus of the right or the inferior oblique of the left eye. So from out of 8 cyclovertical muscles, now we have concluded or evaluated the suspicion to the 2 muscles. So let's move on for the further confirmation of that which muscle is having actually the problem. So now the last and the most important test, which is we have to check the hypertropia in the head tilts. This is the other name of the Bills-Chowsky head tilt test, and in this we ask patient to tilt the head slightly toward the right side and toward the left side. So you should know that when the patient tilts his head toward the right side, in the right head tilt, the right eye has the ability to extort. Extort means to turn the 12 o'clock cornea outside, and the left eye has the ability to intort, right? Intort means that he has the ability to turn the 12 o'clock cornea towards the nose. So now when you ask the patient to turn or tilt his head towards the left side, what happens, that this right eye now has the ability to intort, while the left eye has the ability to extort. Now what happens actually, when this intorsion and extortion in the eyes occur, it will cause the rotation of the image and patient can have problem. So normally what happens, to remove these torsional movements, the vestibular system activates the muscle of the eye that will work opposite to the tendency of the eye, right? So if the eye has the tendency to intort, the vestibular system activates the extorters of that eye, and if the eye is having the tendency to extort, the vestibular system will activate the muscles which help in the intorsions, or the intorter of the eye will be activated in order to cancel the extortion effect. So what will happen, when these both effects will cancel each other and the eye will be in the still position, there will be no movement, and there will be the balance, right? So this is something which occurs normally. So always remember that the intorters are the superior rectus and the superior oblique of the eye, and extorters are the inferior rectus and inferior oblique of the eye. So remember this thing, that superiors are the intorters while the inferiors are the extorters, right? So here you can see that in the right head tilt, I have told you that the right eye has the ability to extort. So here the intorters will activate. That is, in the right eye, the superior oblique and superior rectus will get activated, and in the left eye it is having the tendency to intort. So here the extorters will activate, and the extorters are the inferior oblique and inferior rectus. Thus there will be the cancellation of the effect, and the eyes will be in the centered position and are balanced. So there will be no rotation of the image. Similarly, in the left head tilt, the right eye has the ability to intort. So here, the extorters will be activated, that are inferior rectus and inferior oblique will be activated in the right eye. And in the left eye, which is having the tendency to extort, the intorters will be activated, which are the superior oblique and superior rectus, and they will cancel the effect, and eyes are in the centered position and are balanced. So there will be again no rotation of the image, and this all happens in the normal condition. So now when you have asked the patient to do the head tilt toward the right side, there is no hypertropia manifested. But when you have asked the patient to do the left head tilt, or when his head tilt is toward the left side, you have observed that the hypertropia in the right eye is increased. So what happens, I have already told you to remember that in the left head tilt, the right eye extorters are activated, and in the left eye the intorters are activated. Now we have to go back and see the muscles we have suspected, that were 2 muscles out of the total 4 muscles. Here you can see that we were done with the suspicion that inferior rectus of the right eye may be having the problem, or the inferior oblique of the left eye is having the problem. So now we have to compare the head tilt and that gaze in which hypertropia was increasing. So the hypertropia was increasing in the left head tilt and in the same gaze. That means that when the eye was in the right side, right eye was having hypertropia, and the patient was, when watching into the right side, the hypertropia was increased. So we have to compare these both. Here you can see that the right eye's inferior rectus and inferior oblique are activated, and in the left eye, in the head tilt, the superior rectus and superior oblique are activated. But in the gaze, inferior rectus and inferior oblique were activated when the hypertropia occurs. It means we have to see that which muscle in both the condition are common. So while comparing, we have observed that the muscle which is common in both the condition is the right eye's inferior rectus, right? So this means that when hypertropia was increased in the left head tilt and in the right side, in the right gaze, the inferior rectus of the right eye was activated in these both conditions. This means that the problem was actually in the inferior rectus of the right eye. So this means that there was a palsy in the patient's right eye inferior rectus, right? So this is how we have evaluated and confirmed the single muscle palsy out of the 8 cyclovertical muscles. So this is all about Parkes 3-step test. In case of any problem or query, you can comment in comment section. Thank you so much.